Kindly introduce yourself.
I'm Flavia Bokelo. I'm a caregiver with Nairobi Hospice. Yes, that's what I'm doing currently. It's a cancer center whereby we have different cancer patients coming in, not only cancer, also other life-limiting diseases like kidney failure, but the ones that are coming in mostly at the moment are cancer patients. Yes.
And as we mark this month, as the world raises awareness about breast cancer, I want us to generally talk about, from your perspective, the challenges that cancer patients go through, especially at the beginning of their treatment process. Yeah, both psychologically and emotionally. Okay. Yeah.
Emotionally, well, the patient is just, when they are let to know that they have cancer, at the back of their mind, cancer is death. There's nothing else.
Yeah.
It's just a death sentence for them. There's nothing else to it. So at this time, they have a lot on their mind. They're emotional most of the time. And they feel like no one is understanding how they feel because no one is in their shoes. No one can be able to tell them anything because they don't have the same disease, you see. So most of the time they need support from maybe other cancer warriors who are undergoing the same thing. Yes.
And as they continue with treatment, of course, their body changes. How do you ensure that they, as much as they're fighting this disease, they also try to be positive about the changes that they're going through? Maybe loss of hair, you've lost weight, you've lost maybe a body part. How do you ensure their positivity?
Okay. Most of the time, when you're doing caregiving, as much as the patient is sick, you don't treat them like a sick person. You treat them like any other person. When you're talking, you crack jokes from here and there. When you're grooming her, you ensure what she used to do on a daily basis is what she's doing on a daily basis. Even if she can't, you try help her do it on a daily basis. If she was someone who used to love makeup, you do makeup. If she's someone who loves hair, you can play around with turbans. You can play around with wigs if she has, just to make her feel comfortable most of the time. Because if you treat her as a patient, she won't be able to trust you as well. She won't be able to open up to you. They open up easily if they feel they can trust you. So grooming and everything else, do it the way they used to do it so that they may feel comfortable. Yeah, they don't feel like, now I'm a patient. There are some things, maybe if in case of maybe bathing, you stop bathing them, you stop doing oral care, you should continue with everything just as the way they are doing. Even if you have to hold her hand and help her do it on her own, you should do that.
So that they don't feel that their lives have changed so much.
So that they don't feel.
Let's talk a little bit about the family side and the challenges that they go through as one of their family member is dealing with this cancer. Yeah.
Okay. Yeah, so the family is more or less like the patient as well. They are viewing cancer as a death sentence still. So most of the time, they want a solution to it. They are always looking for a solution. Even if they hear about prayers, they will jump into prayers. If they hear about a treatment that has been discovered, even it hasn't been put to test, they will look for it. So they are constantly trying to find a solution to this cancer. So most of the time, they will be, even if they come to hospice, because normally we deal with the family and the patient, they are always asking us, is there anything that we can be able to do that can reduce this cancer? Or is there any surgery that can be done that can be able to terminate this cancer? Constantly they are looking for a solution. They are not, and they're also facing burnout as well, because most of the time you're not there. They're there alone with the patient. So someone had to leave a job. Someone had to maybe go to work for half a day to be able to take care of the patient. So it's also burning them out, and they also don't know how to handle the patient. There are some things, maybe like turning the patient. You don't know if you're supposed to turn the patient early, so that
Hygiene.
Yes, hygiene. And you also, that's why you get even the patients when they're coming to hospital, most of them have sores because no one has told them that there reaches a certain time, you have to turn this patient as much with the way they are bedridden, or you have to help them walk around, you have to help them with their duties. So the patient is always staying in bed. They know when they're in bed, when they're resting, that's when the patient is at peace, even when they're in pain. That's why they even tell them, si ulale kidogo. If you're in pain, lala kidogo itapungua. They don't know like there's some medication that is required to be given. You need to counsel the patient as well. So there are a lot of challenges. They face a lot of challenges as well at home. That's why hospice care is there for them. Now that's where we come in, and we try and help them. They release the patient to us. We take them through a program. Then they can be coming in from time to time. Like from where I am at Hospice Nairobi, there are no visiting hours. You come anytime you want to come and see the patient. Yes, anytime, even if you want to come the whole day and stay there the whole day, you can be able to come and see the patient the whole day. You can be able to bring them food, you can be able to bring them fruits, you can have other people visiting besides you. There are no visiting hours, because as much as the patient is there, they still need to see their family. They also want like a little bit of motivation. She's well, she's coming to see me. The way she's coming to see me, she's bringing me a little bit, she's bringing me gifts, she's bringing me children. Maybe this is a person that loves children. So when they see their family, they get a little bit motivated. They see another side of life. Besides being sick, with time, maybe I can be like so and so, you see. Yeah.
And as a caregiver, how do you manage reality, expectation, and hope?
Reality, expectation, and hope.
Because with the patient, with the family, there's hope that one of their members is going to get better, but there's a reality. Yeah. How do you manage that and make sure that maybe the family and the patient actually understand what is happening and take them through the journey?
Okay, that's a very good question, because actually sometimes we'll find the patient doesn't know what they're ailing from. The family has not disclosed anything. They're the only ones who know what the patient is ailing. And they'll even tell you, don't tell the patient. Don't tell them at all. Because if you tell them, they'll probably stop. They'll probably see life has ended. So most of the time, we will have the family separately. We will talk to the family separately and explain to them, this is how it is. This is the stage that the cancer has reached. This is how it's going to be. This is the treatment program that we are going to take the patient through. And the aftermath. Now, if there's going to be death, if the patient is going to survive, we will counsel the family first. Then now with time, the family, we will now, as we counsel the family, we will now enlighten them on how to speak to the patient. How to tell the patient, this is what you're ailing from. This is what these people have said is going to happen to you. So because they want to feel comfortable with the people that they trust. If I come to you right now and I don't know you and I tell you, and this is cancer, you have cancer, this is what is going to happen, and this is what is I don't know how to relay that information to you because I don't know you. Yeah. I don't know how you take bad news. I don't know how you take good news. So they also want this news from someone they're familiar with. Someone like a mother, a son, something like that. So you counsel them. You can also counsel the patient separate, assuming probably the family has told you a little bit of history about the patient, how they take things. You can also counsel the patient on the side. Then all together, you bring them together now to a point of acceptance. Though acceptance is also not easy. They will say they accept, but at the same time they don't accept. They reach a point where they say, but so and so got healed. How come my mother or my son is not getting the same treatment because so and so got healed? So they will also reach a point whereby they question a lot. They will question you a lot. Hini ya nini? That medicine, what does that medicine do? And when you give her that medicine, how does she react? Is it supposed to be given on a daily basis? Because I see this is what is happening to her. They are also mini doctors. Family is also a mini hospital on its own, because they know the diagnosis, and they have heard from other people and who have done their own research. Yes, and they've done their own research. And they've heard from other people outside who have said, hey, so and so did this and this. So that is why they are cancer free. So It's just a lot of counseling that is needed for both the family, the patient, and all together. Yeah, like for hospice, we normally have a program whereby at least every Thursday we have the cancer patient and the survivors and the family now are coming in just to meet each other, build friendships beyond illnesses, you know, so that when they come and interact, some of them are cancer free, some of them are still patients. They like motivate one another. So we normally have those peer support groups, and we also have people who come and pray, they fellowship together. So when they are like this, they reach a point of acceptance, both the family and the patient. Yeah.
And there are those people who may not have the financial access to maybe get the care at the hospice and they have to do it at home. How would you advise someone who has to take care of a patient at home? What would you advise this person?
Oh, we also have home-based care. So from time to time, we also go to community outreach. At least every Friday, we go and visit the patient and the caregiver who is there and try and give advice where things are not going well, where things are going well. That is what we do at least every Friday. In case they are not able to come to Nairobi Hospice, we go to their homes. Yes.
Okay. Any advice to any family or an individual who has to start this journey with cancer?
I would say people should go for frequent screening, early screening, at least just to be safe. Because you can be healthy and you still don't know if you have cancer. You can still be like me and you have it, you know. So early screening is needed. And when you get cancer, it's not a death sentence. You can still be cancer free. It just depends on the stage where you are at.
Okay.
Yes, but it's still not a death sentence regardless of the stage where you are at.
Okay. And one last question before we wind up. How do you support family members who are probably overwhelmed emotionally by their responsibilities? Because cancer is very expensive, the treatment. It's emotionally draining. How do you support these family members so that they're able to take care of their loved ones?
Or the caregivers or
Yes,
the caregivers who are within the family. I think it's more or less the same as the home visits, the frequent home visits that we do, and also a call or two. We just give a call because we like to remember our patients. As much as we have a lot of patients, you see, if you come today and you ask me, nilikuwa hapa jana and nilikuwa nataka hii na hii, alafu I ask you, jana hata sijakuona, wewe ndio ulikuwa unaitwa nani, you know. We also like to keep tabs on our patients so that we know how they are going on. If you give a call or two to them and ask them, so and so anaendeleaje, are they okay, what is happening? Now from that calling on and off is when we make home visits as well. Okay. In case they are not okay, now we send one of our medical teams to go to their homes now and check on them. Yes, we have a nurse and caregivers who are experienced, so they just go and see them at home. In case your finances allow, you can visit our offices and come for the best quality care. We are along Hospital Road next to KNH. Yes, we can always reach an agreement because we prioritize on quality care for cancer patients. Not only cancer patients, but patients who have life-limiting diseases.